To complete my bed bath, at first I will gather all of my supplies and I'll introduce myself to the client or patient, and I will let them know that I am their nurse Tanner and I will be taking care of them today. I will then verify the patient's identification on their hospital band. I will then explain the procedure, so I'll let the patient know that today I'll be giving them a bed bath and kind of walk them step by step through it all. I will assess the client's activity and tolerance for bathing. So if they're able to, move their arms and legs, and if they can roll over and help me during the bed bath. I will also assess the patient for any allergies. Then I will assess any bathing preferences, so religious beliefs and what time they usually take a bath when they're at home, and get that all figured out. And then I will also provide privacy, so I'll pull the curtain or shut the door. I then will perform hand hygiene and put on PPE if needed. I will then check the client's skin to make sure there are no abnormalities, so any skin tears or wounds. I will then adjust the height of the bed for a good working level, and then I will cover the patient with a blanket or top cover for privacy, and then I will place the bath blanket or top sheet over the client. I will remove the gown or clothing from underneath while the covers are still on them, and then I will fill a bowl full of water around 120 degrees, and I will add the soap, the cleaning agent, and then I will add the appropriate cleanser for the policy that the facility offers. I will then put on a pair of clean gloves, and then I will wash the client's eyes with a washcloth, and I will fold it, and I'll wash from the inner to the outer, and then I will get a different corner of the rag and do the same on the other eye, from the inner to the outer. And then I will wash the client's face, neck, and ears. I'm going to wash their face, around their neck, and around their ears. So then I will wash the upper part of the patient. So I will get my washcloth into a mitt, just like this, and then I will take the washcloth from the arm that's closest to me first. So let's say it's this one, and I will wash from the underarm to the arm to the hand, and then I will rinse it and dry it, and then I'll apply lotion or deodorant if the client desires. I will then raise the side rail on this side and come over to this side of the patient and do the exact same thing. So from the underarm, their arm to their hand. I will then also apply deodorant or lotion if the patient desires. I will then wash the client's chest and abdomen, so I'll need to pull down the bed bath blanket. And I will raise the side rail and move to the opposite side of the bed and repeat the steps. Oh, I'm sorry. Okay, so now after that I wash the arms, I will then move to the chest and abdomen. Okay, so I cover the client's chest with the bath blanket and lower the bath blanket to the client's. So I need to expose the chest and abdomen. I will wash the client's chest and abdomen, covering in between washing and rinsing. So I'll wash them, and then I'll cover them, rinse them, cover them, dry them, cover them. I will then wash the lower extremities, and I will expose the leg that is closest to me first. And I'll take the leg and I will wash the leg and then rinse and dry, and then I will move from the ankle to the knee, and the knee to the groin. So I'm going to do that. And then I will apply lotion if necessary, or if the client has a desire to. I will also do the same thing with the chest. I don't think I said that. I will then wash the foot, especially in between the toes. Okay? And then I will dry the foot thoroughly and then apply lotion if necessary and if the client prefers. I will then place the side rail up on this side, and I will do the exact same thing on this side. And then I'll apply lotion if the patient desires. I will change my bath water at this time if I have not done so already. Okay, so then to wash the client's back, I'll have a person assist me if the client cannot roll over by themselves. I will turn the client to the side on a laying position with their back to me. And then I will wash, rinse, and dry the client's back with firm strokes from the neck to the buttocks. And then I will give the client a back rub if not complicated. Okay, and then I will wash the buttocks and anus area. Always wash from front to back. So I'll start from the front and then I'll go back. Wash from the front and go back. And then I will place the client on the back in supine position to ensure safety for the patient. I will remove my gloves and perform hand hygiene and put on a new pair of gloves. I will then change the bath water, and I'll perform peri-care and ensure safety for the client. So for a woman for peri-care, I will need to place the supplies within reach to clean a woman, and then I will adjust the environment for convenience, for lighting, and then I will assist the client to a position that accounts for their physical limitations performing the care. I will take a washcloth and soap or a peri-wipe and cleanse the labia and cleanse the rectum. I'm sorry, I skipped a page. I will then with my dominant hand separate the labia, cleansing from the top to the rectum. Wash both sides in the middle of the, I don't know how to say this word, perineum. Use a clean part of the washcloth for each downward pass. So every time I go down, I'll get a new slice of the washcloth. I will then turn the patient to the side facing away from me, and I will wash it between their buttocks, always front to back. And then I'll rinse and thoroughly dry all areas. And then I'll remove gloves and perform hand hygiene. And if the patient is a male, I will adjust the client to how far they can move their legs, and then I'll also adjust the environment, like the lighting. I will use a washcloth, soap, and water, and I will cleanse the urinary meatus first using circular motions. If the client is not circumcised, I will retract foreskin prior to cleaning. I will rinse and dry the area, place foreskin if retracted, and then I'll gently cleanse down the shaft of the penis and scrotum. I will then turn the patient away from me, and I will clean their rectum from front to back. And then I will perform hand hygiene and put on a new pair of gloves. So, now that the bed bath is done, I will be providing denture care. So, I will provide privacy if needed, and then I'll introduce myself. If I'm doing this all during the bed bath, I will not have to redo all of this, but let's say I'm just doing it after the bed bath. So I will need to use gauze and apply gentle pressure to dentures to remove. So I'll take them out of their mouth, and I'll do the exact same thing with the upper. So I'll do the bottom first, and then I'll do the upper. And I will place in a denture cup, and then while I'm doing all this, I'll be providing education to the family members or the patient. I will then wash the dentures in a sink, but before I do so, I'll place a washcloth in the bottom of the sink so it refrains from the dentures accidentally getting broken. I will use a toothbrush and toothpaste and brush as you would with normal oral care. And then if the dentures are being soaked, I will soak dentures first and then brush them as described above. I will use a toothbrush and toothpaste to clean the gums and tongue while rinsing as well. And then when I put the dentures back into the client, I will apply adhesive to the upper gums and press firmly, and then do the same thing to the bottom without the stuff. Okay. And then once both dentures are in, I'll ask the client to bite down and make sure it feels comfortable and secure. If their dentures, they don't want to be worn, I will put the dentures in a cold cup of water in a denture cup, and I will let the patient know that they are in a safe area and let them know where they are at before leaving the room, and I will provide the patient with a call light. Okay, so replacing linens and on an unoccupied bed. I will gather the supplies as needed for this. So unoccupied, I don't need him. And I will perform hand hygiene, verify the patient, checking for identification, and only if the patient is present in the room. And then I will place the supplies on the surface within reach, and I will provide privacy and lower the side rails and adjust the bed to working height. I will disconnect any tubes or equipment from the bed linen, so if the call light's attached, I'll take it off. I will loosen the bottom linens around the bed. So I'll loosen the bottom linens around the bed, and then I will roll the linens into a ball and remove them from the bed, holding them away from my uniform. I will then place these directly into a hamper or laundry bag, and then I will remove my gloves if necessary. And then I will attach a bottom sheet to one half of the bed and then move to the appropriate side of the bed and do the same thing. And then I will, let's pretend these aren't dirty. I'll put a new sheet back onto the bed. I'll place the top sheet with the vertical center fold and place the hem at the head of the bed. And then I will unfold the top sheet and repeat the last two steps with a blanket or separate bed sheet. I will tuck the sheet and blanket or bedspread under the mattress at the foot of the bed. I will make a modified mirrored corner at each corner of the foot of the bed. So let's pretend I'm tucking it, and I make a nice little triangle corner on both sides of the end of the bed. I will make a cuff at the head of the bed by folding down the edge of the sheet and blanket. I will then place a clean pillowcase and pillow at the top of the bed. So, like that. That's what my bed looks like. I will ensure that the client is at a safe position prior to leaving the room and give the call light within reach. And then replacing linens on an occupied bed. So I will gather all my supplies, and then I will identify the patient, making sure it's the right patient, and then I will perform hand hygiene and put PPE on if needed. I will provide education to the client, so I'll let them know that I am going to change their bed sheets and replace them with new ones. I will provide privacy, and I'll make sure that my supplies are within reach. I will ask a second person for assist if I need so. I will then disconnect any call lights and any equipment that's near the linens. I will apply clean gloves and raise the bed to comfortable working height. I will lower the side rails on the side that I'm working on. So these are down and this one is up. I will remove the top linen except for the top sheet or bath blanket, which would still cover the client. So let's pretend. I will remove the top sheet, and then I will assist the client to turn towards the opposite side of the bed using a second person if necessary. I will loosen the linens. I will loosen the linens from the side of the bed that I am on. So I'm taking the linens off from this side. And then I will roll and fold them towards the client's back, getting the linens close to the client as possible. And then I'll put the clean fitted sheet on, and then place the corners of the head of the bed, and the foot are on the side that I am on, and then I will push the rest of the clean sheets towards the middle of the bed and tuck the dirty ones and tuck it underneath the dirty linens. And then I will roll the patient on this side and repeat the process. I'll gently pull the clean linens and secure the corners of the fitted sheet and the head of the foot of the bed, and then I'll grab the dirty ones, and then I will put, I'm kind of confused. And then I'll assist the client back onto their back and apply a clean and then I will apply a clean pillowcase to any of the pillows. So I'll put them back there. And then I will apply a clean sheet and blanket. And then I will tuck the sheet and blanket at the foot of the bed, making a miter corner at each side and then I'll raise the side rail back, and I will remove my gloves and perform hand hygiene. And then I'll assure that the client is in a safe position, so I'll lower the bed and I'll put the call light in the client's reach, and then I will give the client their supply table and reach. And that is all. Thank you. Forgot to do oral care for an unconscious patient, so I'm going to do that. I will gather my supplies and I'll check identification on my patient before doing anything, and I will introduce myself. I am Tanner and I will be your nurse today. I will then let my patient know what I will be doing today, and I will educate them. I will also provide privacy, and then I will wash my hands and I'll put on PPE if needed. I will raise the bed to a comfortable height for working conditions. I will then perform the oral care, and I'll raise the head of the bed to 30 degrees, and I will place a towel under the patient's head, and then I will turn the patient towards me. So just like this. So then I will, with one hand, use a tongue depressor and hold the patient's mouth open, and then with my other hand, I will clean the gums, teeth, and tongue. I will then wipe or suction any secretions from the patient's mouth. I will then wipe off the patient's mouth, remove the towel, and raise the patient back up to a comfortable position, and I will lower the bed and remove my gloves and wash my hands.